Good morning, everybody. Kolkon Oration is one prime event in Iracon, and Kolkon Oration was instituted by West Bengal chapter of Indian Rheumatology Association. It includes a medal and a certificate. It is in recognition of one's overall contribution to propagating rheumatology by the way of public lectures, publishing articles related to patient education, awareness programs, conducting CMEs, enrollment of members, etc. And this year's recipient is Dr. Shiv Prasad, BN. He is from Mysore, Karnataka. He is an alumni of SGPGI Lucknow and has been working in a tier 2 city, Mysore, and he has done a lot of work. In recognition of his work, IRA has recognized and conferring Kolkon Oration to him for this year 2022.
At the outset, I would thank the IRA and IRA 22 committee for giving me the opportunity for this Kolkon Oration. So when I first thought about what has to be presented or what has oration this one, so I got suggestions saying that start from wherever you have started your rheumatology journey. So today as such, I will be presenting my journey in rheumatology and what is my work in rheumatology. So my journey first started in 2008 July when I first joined as a non-DM SR in SGPGI Lucknow, and subsequently in 2009 I joined my DM SR. So first we started my work. I started as the presentations, like the poster presentations and other things, paper presentations. So my first presentation was in Jaipur, Iracon 2009, when I presented my work on extraspinal musculoskeletal tuberculosis. And then my best part of my paper presentation was in the APLAR, that is the first symposium of Asia-Pacific APLAR region in Taiwan 2011, where I presented 3 oral paper presentations. So one on methotrexate induced pancytopenia, and the next one is on the extraspinal rheumatological presentations of tuberculosis, and other one on my project work on multi-drug resistance protein expression and function in rheumatoid arthritis, predicting the resistance. The next international presentation was in Australian Rheumatology Association presentation in 52nd annual scientific meeting in 2001 Brisbane, where I presented 2 papers, which was the first one, the oral presentation, was selected for the new investigator free paper session, and the second one is poster on leprosy. My work, majority of my work is based on tropical rheumatology during my residentship. And I'm happy to present few things which I think that is significant. So for one of my first work, which was on leprosy, where I had presented around 44 patients, and which is the largest numbers from a rheumatology center. The uniqueness of this series is all the patients presenting to the rheumatology department without having a diagnosis of leprosy, we are diagnosing it for the first time, in which the patient presented, majority of them with erythema nodosum leprosum and the pure neuritic leprosy type. Majority of them had paresthesias and nerve thickening. So with this study, we concluded that recognition of an infective agent as an etiological factor in rheumatic manifestation is important. The absence of classical cutaneous manifestation like hypoaesthetic skin patches or should not deter in diagnosing the leprosy. Recognition of the rheumatological manifestation of leprosy is important for us because and the previously diagnosed leprosy, arthritis diagnosis becomes very easy, but when it comes to the first time in the rheumatology OPD, it is important for us because leprosy again can mimic any of our rheumatological disorders, especially RA, vasculitis and even spondyloarthropathy to a certain extent. So history of paresthesias and examination for nerve thickening and subclinical neurophysiological abnormalities should give us a clue to look for the patients, especially with pure neuritic leprosy. The other major work of mine on tropical rheumatology is the extraspinal musculoskeletal tuberculosis. Again, we have described around 51 patients, and this is one of the largest series from a rheumatology center. And the important of this is there is no spinal involvement. In this, whatever we have described, there is no spinal involvement because when we compare the presentations from the orthopedic or the previous one, majority of them are presented with spinal involvement and the hip joint involvement. And here we have described all of them are immunocompetent personnel. There is no chemotherapy or malignancy in this group of patients. Pain and swelling were the most common presentations. Again, Ponsett of the 51 patients, 5 patients are presented with Ponsetts, and associated lymphadenopathy other than the chest was identified in around 25% of the patient. Arthritis or arthralgia was the most commonest manifestations. Monoarthritis was seen in 28 patients and oligoarthritis in 10. Here the point to notice, majority of the time we always think tuberculosis is a single joint disease, but here we have around 10 patients who are having oligoarthritis. Polyarthralgia as a part of Ponsetts was seen in another 2 patients. The most common, as I described, from the other series is always the hip joint, which is the most commonly described one, but in our series we had knee and ankle as the most common joint involvement. Other important thing, when we compare our study to the other published studies, so in our study there was no spinal involvement, where there are other studies which are major of spinal involvement, and associated pulmonary involvement was very much less in our series when compared to the other series. Again, lymphadenopathy has not been described in any of the other studies. And this was published in IJR, and this paper was awarded as the second best original paper in 2016-17 for the publication in IJR. So after things which we feel we have done our best in our institute, but when we go to the real world, there we face the challenges. So when I decided to go back to Mysore in 2013, as sir mentioned, it is a tier 2 city where we have to, first we have to sensitize our own colleagues, doctor colleagues, about the department or about the rheumatological diseases. So for the first time, so apart from the institute, so to sensitize, first I planned myself to sensitize the hospital wherever I joined, to sensitize them about the rheumatological diseases. So I started within the hospital, the breakfast meets with all the physicians, super specialties available over there, and over a period of time, next 6 months, 3 months, 1 year, over a period of time, the hospital people themselves got acquainted to the rheumatology, what rheumatology is. So after that, I started with people on the peripheral camps, peripheral talks and other things. So the next, my major work, obviously in the last decade. So since I left the institute, so every 3 to 4 months once I go and give talks, make awareness about the rheumatological diseases in all our possible doctor colleagues, including the associations like IMEA, API, dermatology, ESI, all the groups which are available, and even orthopedic tried to sensitize the orthopedicians and the pediatric group also. Not only this, so in Mysore, I have been as a resource personnel in the national conferences, some of the national conferences held in Mysore itself, where this rare metal project or BARC national conference in 2014, and HIV conference, which was national conference held in Mysore, and again the physiology conference held in 2009. Other than that, being in the Tier 2 city, so as a part of awareness among the doctors, so singularly may have done to a certain extent, but as a group, I tried to impress upon all of my doctor colleagues about the rheumatological diseases. I and Subramaniam together in Mysore, we tried to sensitize people about this one. So we started the program which we are still continuing to doing in rheumatology in Mysore at present. I started this program around like rheumatology CME in Mysore, and we have been conducting it every yearly and sometimes every 6 monthly depending on the situation. And I started this CME series from 2014 February we have started, and this is the first program invitation which we have sent across all the doctors. And in the first one we have presented our giving an introduction about rheumatology. So we started with approach to arthritis and the back pain and introduction to connective tissue disease and other things. And at this time Subramaniam and Yogesh were there to support me for all these things. And continuing with the CMEs, so we had presented multiple CMEs depending on the disease itself or on the combination or in association with other super specialties, nephro, neuro, pulmo, derma and other things. And in all the CMEs, Subramaniam and colleague friend from Bangalore has always helped me to conducting this CME series. And in 2018, again Subramaniam and me have the opportunity or fortunate enough for us to conduct the South Zone Iracon in Mysore. So we had 3 international faculty at that point of time, and all the KRA family have helped me or helped us in conducting, and we were very much successful in conducting the South Zone Iracon in 2018. Again, so apart from the doctor colleagues, I also tried to have the public awareness in terms of radio talks, TV talks, and giving a CME or to the non-medical friends and the different clubs, Rotary Club, Lions Club and other things. And again, there were some other companies which had access or they had the routine doctor interaction. So we also went over there and presented them and discussed them about the rheumatology as such. So in being in a private sector and so work of mine, so I've continued to work the academic works over there. So I have been resource personnel and I have got multiple presentations in Iracon and South Zone Iracons. So this is one of the presentation in Iracon Lucknow, where I had a poster presentation on sarcoidosis. The best of the presentations, or this one was done by the resident Dr. Shamala. She presented this in Korean Rheumatology Association conference in Seoul in 2019. Apart from that, I and Subramaniam has been associated with articles where we had an invited article in Karnataka API journal, where we are presented 2 review articles, Biologics, a tectonic shift in management of rheumatoid arthritis and the management of ankylosing spondylitis, present concepts and guidelines, for which we had awarded the best review article in the year 2020. Apart from that, being in as a Karnataka Rheumatology Association in Karnataka, so I was been fortunate enough to be associated with multiple collaborative studies, of which so I have been able to contribute for around 8 publications. As a part of KRA, I was also a EC member and currently working as a treasurer in the Karnataka Rheumatology Association. I am working on the sarcoidosis. Current interest is on sarcoidosis. I have been presenting multiple case reports and case series in IGR for the same. So I have presented like cutaneous sarcoidosis with 2 different skin lesions, isolated organ involvement like hepatic, lacrimal, and cardiac, post-malignancy sarcoid-like reaction also. And recently I have submitted this, and this article has been accepted and yet to be published. I have been trying to collect data, the multicentric data from on sarcoidosis, and this is the heading is around like rheumatological perspective of sarcoidosis. I am trying to collect data from multiple centers in Karnataka with association with Karnataka Rheumatology Association. So these are my works and current interest which I am doing at present. So before I can complete my talk, I would like to say my gratitude because of them I am able to stand in front of you. The first person is Dr. Professor Dhruv Chaudhary. He was my guide when I first joined as an MD candidate, and I would say that he was the first person who introduced me to these academic presentations and academic work. So he made me to be smitten by the publication Kida, and I am still carrying it on. So my first gratitude in this my work goes to Professor Dhruv Chaudhary, and again Vikas sir. So when I joined my DIA as a DM resident, from that time till date, so I am very much indebted to Dr. Vikas because on all his guidelines and all his support. So he always used to say, so after I came out of the residentship, of course, Shiva, you are the alone person who has presented 3 oral papers in an APLAR. So I don't know whether it is this one, and I am very much thankful. And whatever the work I have done is on the basis of what Vikas sir has said. He used to say, Shiva, हमारे पास क्या है, हमारे पास जो है उसको present करना है. And that was the thing which promoted me to work on tuberculosis and leprosy, and that's all the words I can say for him. And again, since the start of my DM, the day I joined my non-DM residentship, from the day to till date, so Dr. Yogesh has been like a big brother for me, supporting me personally and professionally and personally, and talking about collecting a little bit from collecting the data, understanding anything in rheumatology. He has been helping me for till date. He is there on the backside whenever I fall, whenever I feel, wherever I am lost. So I would be asking him to seek the direction where to go. And nothing less than saying about the KRA family. So since I think if I remember properly, 2015, I think so. So we have been very much like a family, doing things together and working up with all other whatever it is there, from scientific work to personal things. I would thank all, I can't name each and every person, but I would thank all the persons who are supported us, and especially when I and Subbu was given the job of conducting 2018, and it was on the spot which I most probably because of the support of Dharmanand sir, Vinita Shobha madam, and Chandrasekhar sir, they had, and Mahendranath sir, so they had all on our back to support us with all the work. And till date, whatever we are together as a KRA family, I would thank all of them for supporting us. And even so, for the application of this Kolkon, so Dr. Dharmanand sir and other people have supported me they said me that Shiva, you have to apply for it. So not last but not least, so my family, so Kavita, so actually when I started my DM, so we had like just married in 2008 in March, and again I entered SGPJ in 2008 July. So I thank all our support since the day we have been together, and today we are like whatever I'm presenting over here, and for all my work which has been and background support of my wife. Thank you.
So, on behalf of IRA, especially West Bengal branch of IRA, I sincerely thank you, Dr. Shiva Prasad, for your excellent talk during this journey, during your academic journey, and how well you expressed in this Kolkon oration. And it is amazing that how you have taken up the tropical rheumatology and your works on tropical rheumatology and sarcoidosis, and it's you are keeping it up. So I wish you all the best, and I sincerely thank you for this excellent presentation.
Thank you, madam. Thank you.
So, since there is no question answer session for this oration, I conclude this session then.
Thank you, Shiva Prasad, for this wonderful talk. Now we'll move on to the next oration, which is called IRA Young Rheumatologist Oration. And this year's recipient is Dr. Ankur Jindal. And Ankur Jindal is an alumni from PGI Chandigarh. He's an assistant professor of pediatric rheumatology. Just give us a second.
I'm sorry to interrupt. We for this session we have another chairperson whom we want on the dais, Dr. Vishal Marwa. Dr. Vishal Marwa from Kochi.
This IRA Young Rheumatologist Oration is in recognition of one's scientific contribution to the field of rheumatology. And the criteria is they should be young. The criteria is less than 40 years. And it includes a medal and a certificate. And it is done in recognition of their scientific work. And I've already introduced Dr. Ankur Jindal. He's a pediatric rheumatologist working in PGI Chandigarh. And he is a deserving candidate this year.